Today, I'll tell you about Addison's disease. Another name of Addison's disease is hypocortisolism. Hypo means less, and there is decrease in the secretion of glucocorticoids and mineralocorticoids. So, you can see here insufficient production of glucocorticoids and mineralocorticoids. It gives rise to Addison's disease. Okay. There is another term that is called as adrenal insufficiency. So this is a medical emergency and a very much life-threatening condition. Okay, we'll talk about it later. First of all, let me tell you about the causes of Addison's disease. The clinical condition can occur because of autoimmune inflammation of the adrenal cortex. Okay, now why does this autoimmune inflammation occur? The reason behind the occurrence is autoimmune response against 21 beta hydroxylase. You must have heard about this, or you must remember, I would say, about this enzyme, because we had talked about this enzyme when I was telling you about the synthesis of adrenal cortical hormone. What is the role of this enzyme? This enzyme was primarily involved in the conversion of progesterone to 11-deoxycorticosterone. It is a very, very important step in the synthesis of glucocorticoids. Okay. It can occur because of tuberculosis, inadequate availability of cholesterol for the synthesis of steroid hormones, and because of congenital adrenal hyperplasia. Now, how does a patient represent? There may be occurrence of weakness, loss of weight, fever, headache. The patient may also present with nausea, vomiting, nausea, vomiting, diarrhea, ultimately causing dehydration and hypotension. There was occurrence of hypertension in case of hyperaldosteronism, but here there is occurrence of hypotension. Why hypotension? Because there is insufficient production of glucocorticoids as well as mineralocorticoids. Okay. Hypotension decreases the workload of heart as well. Okay. There will be pain in the joints and muscle. You can see some pigmentation over the skin. Okay. Like this. Over the buccal mucosa, over the pressure points, you can see the hyperpigmentation. There can be darkening of the palmar crease. You can see here, there is darkening of the palmar crease, recent scars over the nipple, buccal mucosa, and over some friction-prone sites. Now, what is Addisonian crisis? Severe adrenal insufficiency. We had talked about it just now. Adrenal insufficiency. It is life-threatening condition and a medical emergency. Okay. So the condition is characterized by hypotension and shock. The patient may experience sudden and very severe pain in legs, over the abdomen, over the lower back. Severe vomiting can also occur, diarrhea causing dehydration, lethargy may occur, person can present with psychosis, hyponatremia, hyperkalemia, convulsion, fever. Okay. Now, fatal hypoglycemia. It can occur in the fasting state or in case of stress. Collapse may also occur. Why does it happen? Because of lack of adrenal supply. Okay, person can experience water intoxication as well. Okay, now how do we treat these conditions? The gold standard test is your ACTH stimulation test. Here it is described in detail. ACTH, it is injected in minute amounts, and the level of cortisol and aldosterone, these are measured. Okay, so whether the defect lies at the level of adrenal or at the level of pituitary, it can be distinguished by this gold standard test, ACTH. That's why it is referred to as gold standard. Okay, if there is low production of cortisol, we can say there is defect at the level of adrenal, because we are giving ACTH. Why there is not rise in cortisol? There must be some defect at the level of adrenal gland, or at the pituitary. If it is there, then person will be having low ACTH only. Coming to the treatment part, these are the drugs that can be given to the patient. Hydrocortisone, prednisolone to replace the missing cortisol. Flitocortisones, they can be given to replace the missing aldosterone because here in this case there is a deficiency of both mineralocorticoids as well as glucocorticoids. So we'll have to replenish these two. Injectable cortisol can be given in case of emergencies. Intravenous glucose can be given. And we have to give the treatment for diarrhea, vomiting to prevent the progression towards Addisonian crisis. Okay. Thank you very much.